Awareness is power.
And it could save your life.
Welcome to our podcast, No Risks.
I'm Heather.
And I'm Lee. We're two moms, a lawyer and a nurse, who were brought together by a misfortune. Both our children were harmed by adverse drug reactions.
The purpose of this podcast is to educate people on the risk of any health treatments you put in or on your body.
We feel if we'd been properly informed and been our own experts, our children would not have been harmed.
In today's world, with medicines being incentivized for profits, you need to educate yourself. Know the risk of health treatments, and it can protect yourself and your loved ones from being harmed.
So here we are today, and we've done numerous wonderful podcasts, and we hope to do many more, some coming down the pipeline. But I was just listening to a interview of a really well-known cardiologist from the UK, Dr. Malhotra, and some of the things that he said really struck me, and just thought we'd have a quick conversation about it. But he was saying in the US, there's something like $3.5 trillion spent on, healthcare there. And the US tends to have one of the worst health outcomes in the world. One of the things, some study, and I'd love to get my hands on it, so don't quote me on anything I say, but he was saying that the higher the amount spent on healthcare in a certain area, there is evidence to show that there's actually worse health outcomes. And he was speaking about physicians. In order to give practice ethical medical practice, you need to be giving this informed consent. And I know a lot of our podcasts have talked about the importance of informed consent, but he said, when a patient is actually given informed consent, and the example that he used was to do with his work in and around statins, and that I think he mentioned it was only like 1% benefit. And he said, if patients are presented that information, more often than not, they're choosing a more conservative option, whether that be less surgery, less medication, and certainly in this scenario of statins, not a prescription. So that alone is saving healthcare costs. But what they're finding is that it actually doesn't have a worse outcome. And matter of fact, in numerous cases, it actually has a better outcome. So, you take a medication like statins, and I know this is a topic that we really want to cover in the future, that he's saying only has 1% chance of benefit. But what are the side effects? Because I know, looking into it when my mother was being prescribed statins, that there's a huge correlation with memory loss. So, it's always that risk versus benefit. But very interesting to me, less drugs, the concept that maybe less prescribing is better. Obviously weighing risk and benefit, and there's some medications that people necessarily do need, and they're life-saving and life-changing. But
yeah, and another, really knowledgeable researcher on statins is Dr. Beatrice Golomb that we had on. Now, we had her on to talk about the Gulf War. I wish we could have kept her, and I hope she'll come back on to talk about statins. But she did a wonderful article for the BBC where she touched on statins and how they actually change your behavior.
yeah,
When you're lowering cholesterol to such a level, it could have different outcomes of aggression in people also, which is just, it's just so interesting, that a lot of times, as you mentioned, these drugs are given, but if we really had an opportunity to contemplate, if we were given informed consent, which is an obligation, it's mandatory. We should be given informed consent for our health treatment. That's our right as healthcare consumers. And unfortunately, that's not being done. But if that was the case, where those risks and the benefits, were weighed and you made a decision, and also what's not being done in a lot of cases too is alternatives to the medication. A lot of these things revolve around diet, and that's something and movement, exercise, things the human body needs to thrive. And those have really been taken out of a lot of these conversations as options. Because unfortunately, and I think I mentioned in other podcasts, for years, many years, I was an executive in a healthcare setting, mental health care. And the area I focused on was prevention. And, as a parent at the time with young kids, we like to think about prevention. Unfortunately, the way I see it, and of course, this is my opinion, but a lot of prevention, especially in behavioral health care, is medication. It's screening. The screening is very broad. I think if any of us took a screening for a behavioral health issue, we'd all probably have some diagnosis from the DSM-5,
Mhm.
whatever that might be. Um, but there's a medication to address that, and we're really bypassing the issue. Someone might be going through a rough time, it might be past trauma, whatever it is. But what we are learning, especially in that arena, is that these medications are not an answer. And I hope to have more,
Yeah.
discussions about that, maybe even getting Dr. Healy back on to talk about that. But, what we do know and what he did touch on is these drugs are not quick fixes. People are not only being told of the risk, they're not being told of the nature of taking them, the risk of not being able to get off them,
Yes. Yes.
because getting off them is horrific. And in so many people I've talked to, whether it's SSRIs, antidepressants, the whole line of mood stabilizers, coming off of them is much worse than the symptom they presented with at the healthcare provider's office. And that is a long process.
And
And
dangerous too.
it's just a shame, because here they are now, they're stuck and dangerous. You're absolutely right. But there was no warning of this. When was it? Just a few years ago, there's been a warning that benzodiazepines, your Ativan, your Xanax, are addictive. They didn't. How could that have not been known? And again, of course, we're giving our opinions here, but I don't know how you get away from the fact. You just mentioned it when you talked about this doctor. We have tremendous healthcare costs. We have industry making huge profits off of us being on medications or sick. And with all this science that they want to promote, that a different spin on that story is that these are advancements and we can address different issues now, and how wonderful science is. Then why is the mortality rates going down? Why are young girls committing suicide at higher rates than ever? And we have more access and more young people, more adults on all these drugs. It doesn't comport. So if we really want to look at science, why wouldn't we start there?
Mm.
Um, it's it's really incredible. I would love to see this discussion that you saw. I'm not familiar with that doctor, but maybe we can even encourage him to come talk to
Yeah,
us.
he would be
It sounds
wonderful.
like it would be a fascinating conversation. But yeah, I think a lot of this does go back to informed consent, because I don't think anyone would sign up for this, you know?
He also mentioned something, and I know that we discussed this in one of the podcasts with Dr. David Healy about the randomized control trials. But a lot of the medical students that are have come out, they're not they're reading the literature, but the literature now we know can be biased. It can be funded by the industry and not really showing the raw data like you had mentioned earlier,
Mhm.
just showing potentially the benefit but not looking at the harm.
Mhm.
And so if these physicians are only reading these certain publications that aren't presenting all this raw data in both sides, then that's the information. So, how are they even able to provide informed consent if it's not
Mhm.
even there? Like, I mean, obviously, some of it was in the case of my daughter receiving a medication. Of course, there was information that I should have been informed of. But in some of the cases, it's also just them being taught to critically look at the statistics and health statistics and the true story about some of these medications.
Yeah, and they're not even aware that they're not even aware. They don't know what they don't know.
Exactly.
That is the problem. They're not getting that data. They're completely, and I don't say ignorant in just by the meaning of the word, but they're unaware or ignorant of what that raw data is. There's, ghostwriting and only getting a portion of the data. And that can be a viable excuse for a doctor, but I think my point is, and this came after going through 9 years of litigation when I had people telling me, "You can't blame the doctors. They didn't know." Even some of the initial experts I talked to told me that do confirm the reality of this, that doctors aren't getting the proper um, data, and either what they're getting, and what they think they're basing their scientific decisions in is flawed. I could never go that route though. Now realizing, that's me and I am an attorney, but when you have, in my case it would be a client, in a doctor's case a patient, coming to you and offering you an explanation that they feel is the reason for whatever the illness or ailment might be. I mean, even if you initially want to disregard that, if the patient, as in my son's case, continues to get worse with either providing more medications or different medications with the same diagnosis, um, when that treatment becomes destructive, you have a human obligation. You're seeing this happen. You have an obligation to change course. And at some point, and I would hope it would be sooner rather than later, explore what, the patient is telling you. That is, in a nutshell, the doctor patient relationship. And if you don't have that, you don't have anything. And so I think it's becoming cliche, but it's very true. If your doctor won't listen to you, we hear the word being gaslighted and all these things when people have adverse drug effects. If they won't listen to you, you need to get out of there. When they start, as Dr. Healy said, parroting responses to you that totally undermine your concerns or your questions, go find somebody else and do it with a quickness, because the result of a continued trust of that type of care is, what happened to my son. It's a fatality and it's unnecessary. And a lot of cases, they're treatment induced.
I would think, Heather, that you mentioned just the word trust, and that was another thing that I heard in this interview was that the trust in physicians is, in a lot of cases where people have been harmed or not been given proper informed consent, the trust is going down. And, these, one would hope that the physicians will, um, you know, keep doing their research and provide in being knowledgeable and making sure that they do give the informed consent, because there is no perfect option. And there are times that medications that are dangerous absolutely need to be used. It is the risk versus benefit. But being allowed to make your own decision and having a physician that supports your decision. I'm not willing to take that risk. I can give one example. Somebody had recommended to Charlie to do the hypobaric chamber after she had been injured. They had said that that could potentially be, it was a physician, said it could be helpful. But I had just been through where I trusted someone. My daughter was harmed. I wasn't given proper information. I was terrified of anything that could cause further harm, and wanted to be very careful. And everything that I did, I usually got 2 or 3 opinions, and I researched and I read. And at the time, I was nervous about putting her in a chamber where you're locked in and you can't just open up the door because you have to depressurize it. And if her eardrums, I just couldn't even go there. And subsequent, I haven't done enough research on it to know if it would have been beneficial or not. I don't think it would have been as harmful as I thought at the time, but I just wasn't prepared to take that risk. And that physician supported that decision. He said, I understand where you're coming from. Let's find another option. Like, we won't go there. And that's what I think needs to happen, is there needs to be a relationship of trust. And like you said, if you're not getting that from your physician, there's somebody else out there that hopefully, there are some very good physicians out there. We don't want to like put them all in a box of, I just think you need to be your own expert and find the right
Yeah.
physician as well.
And there's no reason to put them in a box, because it's that relationship that will show us, you know. We can go in with a trusting attitude, but when those flags come up, when you're not listened to, when you know, that relationship is either never established or eroded, that could be one of the biggest detriments to your health, has anything. And the what we want to call red flags are clear. It's essentially being ignored. And when that happens, and there are good doctors out there, I think we've found a lot of them.
Yeah, we have.
Um,
And we're going to
and
have more of them
hopefully,
on our show too. So,
most definitely, we have a lot of, I think, initially how we're kind of rolling this out, and I think it wasn't by any contemplated plan, but I think it's important. We've talked about the fluoroquinolones, they've affected our lives greatly. Would like to talk more about psychotropic drugs, that there's huge issues there. And also this issue, you want to look at informed consent. We've talked to Andrew Marriott, that'll be posted soon, and Dr. Golomb on Gulf War illness. These are people who are ordered to take these drugs. I mean, even then, there should be, just on a basis of, integrity, and these people are offering to serve their country. They should be made aware of the risk. I mean, of putting these drugs in their body, because we'll learn with Gulf War illness, we'll learn firsthand from Andrew Marriott. These, I mean, the what they're suffering from taking these drugs is lifelong,
yeah.
and in a lot of cases, it's irreversible. And in many cases, it has been fatal, for the very reason that a lot of these issues are labeled as something else, um, rather than an adverse effect to the drugs that the military, whether it's US or, Andrew's from England, um, labeled something else, oftentimes a behavioral health problem or a mental health issue, where more medications are given, causing more toxicity, and really just the most destructive treatment you could think of. And these are people who opted to serve their countries. So it's
Yeah.
something that really, that those stories to me are just heartbreaking,
Yeah.
because especially in his case, the soldiers had no clue. Now it started circulating, you'll learn from his podcast, amongst the soldiers, especially I believe it was the French soldiers, who are like, don't take that. But this is coming top down from the military, when there was certainly complaints, and I don't see how there was not an awareness of the harm that these drugs were causing to an awful lot of our military.
Yeah, if you haven't, we'll be posting those shortly, or maybe they've already been posted by the time you listen to this. You have to listen to, they're very, very, and he's also got a great book. But please listen to the podcast.
If you wake at midnight, yeah.
Yeah, on Andrew Marriott, and then also the one with Dr. Beatrice Golomb on the Gulf War illness.
Thank you for joining us today on this episode of No Risk. And remember, being your own expert is the best way to prevent yourself or your loved one from being harmed.
And please join us for future podcasts and help support us by subscribing, providing some feedback, and of course, giving us a 5-star rating. You can also follow us on Facebook and Instagram at No Risks, and check us out on our website at norisks.org, where you can read our stories, suggest future topics, and share your stories.